Our body is very sensitive to low oxygen level in the blood because without oxygen, brain cells start to die within 5 minutes, and this process is irreversible. That's why we'll talk about the top 7 hidden causes and signs of reduced oxygen level in the blood. Medically, low oxygen in the blood is called hypoxemia, and low oxygen in the tissues is called hypoxia. First, prolonged sitting causes hypoxemia. If you need to take deep breathing and more frequent yawning, feel of air hunger while sitting, relieved by standing, walking or stretching. It is sedentary caused hypoxemia, common among office workers and people who have high screen time. Latching position compresses the diaphragm and breathing becomes shallow. Also, poor posture can lead to microatelectasis, small areas of lung collapse, particularly in the lower lung fields. This decreases effective oxygen supply to the body. We measure if a person has low oxygen with pulse oximetry, which is a simple device but highly accurate to detect low oxygen in the blood. Normal oxygen saturation is more than 94%, and at such cases, saturation is usually normal or slightly lower than normal. Pulse oximetry may show normal readings, but drops slightly when sitting for extended periods. Encourage deep breathing exercises. At this case, the solution is to walk, stretch, or exercise every 30 minutes. The second sign of hypoxemia is anemia. At this case, the person feels persistent tiredness and fatigue even after rests, pale skin and nailed. Because of low hemoglobin, the person starts shortness of breath or dyspnea on physical exertion, even previously manageable. And the person has increased heart rate even at rest or on minimal physical exertion. Hair thinning and pica, craving for non-food substances like ice and chalk. Cold hands and feet due to narrowing blood vessels on extremities because the body diverts blood from secondary to vital organs.
Despite clear symptoms, pulse oximetry often shows normal readings, 95–100%. This contrasts with lung-related hypoxemia, where SpO2 typically drops. Anemia treatment is dependent on causes. The most common cause is iron deficiency. Anemia is diagnosed with blood tests, complete blood count, but if needed, iron, vitamin B12, and folate studies may be required. Anemia is common among women with heavy menstrual bleedings, pregnant women, and vegetarians, and older adults with poor absorption.
The third common cause is mild undiagnosed asthma. Person may have chest tightness and noisy breathing from time to time, especially seasonally or during weather changes. People often dismiss it as allergy or minor respiratory issues. Persistent dry cough that worsens at night, often without noticeable wheezing, anxious discomfort or coughing during or after exercise or physical activity. At this case, commonly people describe hypoxemia as feeling they can't catch their breath, especially after exertion. When you examine the person physically, they appear normal, but symptoms worsen during respiratory infections. Spirometry is used to diagnose asthma, though it can be normal during routine testing. It may need to be measured during exercise or with cold air. Oxygen saturation is usually normal at rest. After exercise or during exacerbations, it can be 92–95%, which means mild hypoxemia. Undiagnosed asthma is common among children, young adults, people with allergies, and those living in cold climates.
The fourth cause is nasal congestion during allergic rhinitis or sinusitis. Mouth breathing is the main problem here because nasal breathing enhances nitric oxide production, which improves oxygen uptake in the lungs. Mouth breathing means lower oxygen delivery. Also, chronic nasal swelling narrows the airways, reducing airflow and causing nocturnal oxygen desaturation, particularly during sleep. Patients often feel daytime tiredness despite adequate morning headaches and dry mouth. This mild hypoxia and carbon dioxide retention overnight causes mild headache, frequent yawning and sighing, snoring and restless sleep.
To identify this problem, block one nostril and inhale through the other, then repeat on both sides. If you are unable to breathe on one or both sides, it indicates a nasal breathing problem. If you need more effort to breathe through the nose or cannot sustain nasal breathing for 30 seconds, it is a sign of nasal congestion. Common treatment methods are nasal saline irrigation, and if allergic background is present, intranasal corticosteroids like fluticasone or antihistamines. It is common among people with allergies and frequent sinus infection.
Fifth, hypoxemia can be caused by heart failure, especially when it is newly occurring. First symptoms can be only dyspnea on exertion, while normal echocardiograms. And difficulty breathing when lying down, called orthopnea. Mild swelling in the ankles or lower legs, which worsens at the end of the day. And the person is tired out of proportion to physical activities. Oxygen saturation can be normal. But if after 6 minutes of moderate intensity work, saturation drops 3 to 5%, it can be an early sign of heart failure. Heart failure risk is highest among adults over 65, hypertension patients, diabetics, and people with obesity. The sixth cause is serious but rare, called interstitial lung disease, when a person has dyspnea on physical exertion but minimal at rest, and fine Del-chloride crackles at the lung bases during auscultation. The subtle clubbing or a non-productive cough. This condition is very uncommon before 40, more common among smokers, people exposed to occupational dust like miners and construction workers, and people with autoimmune diseases like scleroderma and rheumatoid arthritis.
And seventh cause is chronic obstructive pulmonary disease. At first, a person has mild breathlessness, which worsens during physical activity. Chronic cough with minimal sputum, more common in early stages, often under-recognized. Early COPD may show mild hyperinflation on the CT scan without significant obstruction on spirometry. Normal spirometry at rest. Reduced peak flow during exertion. Oxygen saturation is usually 92 to 95% during physical activity. COPD is common among smokers, people with long-term exposure to pollution, and those over 40.